Welcome, everybody, to the International College of Integrative Medicine podcast, translating science to clinical practice since 1983. I'm your host, Luke W. Russell, and today I'm joined by Dagmara Beine. Could you tell us a little bit about you and your practice?
Yes. So I am a master's physician assistant by training. My practice is located just outside of Milwaukee in Mequon in Wisconsin. And we actually opened our doors just a little over a year ago. It's what I would refer to as a primary care integrative practice, but we definitely have our specialties. We see lots of women, lots of cancer, and particularly my passion is pediatric cancer.
So, first I'd like to start by hearing how you, because if I remember right, you said you worked in the emergency room previously,
Yes.
and then now you're working with pediatric cancer. That's a very different world. What happened?
Yes. So I was working in the emergency department as a PA for 13 years at the time. And my then 3.5-year-old daughter was diagnosed with a rare form of acute myeloid leukemia, which is just a really crappy cancer. And on top of the really crappy rare cancer, genetically it was one of the worst ones you could have. And very quickly, through that first month of fear and conventional oncology, I had a couple light bulbs go on that made me feel like maybe conventional medicine isn't doing everything that they should be to save my daughter's life. One of the first things being that they wanted to just have her on Pediatric for her caloric intake, which is like high fructose corn syrup and corn.
Yeah.
And then from that light bulb going on, it just snowballed into, while we were inpatient for 6 months trying to save her life and doing chemotherapy, because in America, any child under 18 who's diagnosed with cancer cannot say no to conventional treatment. I just dove really deep into every integrative oncology book, video I could find. And then that very quickly turned into really having a hard time once our daughter came home and started being in remission and our lives started to sort of return to this new normal. It was really hard for me to go back to conventional medicine, and that evolved into going back to school and tons of amazing conferences like this one, and then becoming the practitioner that I really needed on my journey that I couldn't find. There was a lot of integrative practitioners who take care of adults with cancer, but when you call them up, nobody wants to take care of kids with cancer, knows how, whatever the reasoning may be. And so I couldn't find anybody in America at the time to help guide me. And so I wanted to become that practitioner for all the families. Right now, pediatric cancer is the #1 killer of kids under 19, which is crazy. I mean, it used to be like diabetes or asthma were the #1 chronic disease of kids, and now it's cancer. And so really this was just the evolution, and still is, of me becoming that practitioner for pediatric cancer families, not just locally but nationally, to be able to become part of their team and help guide them in their decisions.
So, when you talk about working with families nationally, what does that look like?
Yep. So while I have a local practice and it's always ideal to physically see and examine my patients, there's a really, really great need right now nationally because there's so many thousands of kids being diagnosed, in helping parents through the process of all the way from diagnosis and what do I do now, through I have a child who is now done with cancer treatment, and now what? Because there's really no follow-up. I mean, conventional medicine has, let's do a scan every 6 months or let's do blood work every month. But past that, nobody talks about what should my child be eating? How can I detox? What other integrative therapies should I be doing? And so I do tele-wellness consults where I spend 80 minutes initially, just like as I would in the office, with somebody through sort of like FaceTime, but a medical version. And I get to know the family, what stage they are at, and how I can support them. Sometimes that is just walking them through. People come to you from varying backgrounds, so some people don't understand the difference between organic and non-organic, and other people are doing so much that you're like, whoa, like 50 supplements is not necessary because you read about them on a Facebook page. So however I can help guide them is what I do. And then I try to anybody who is my patient nationally obviously has to have a local practitioner, and then I try to work closely with them and kind of being like the pediatric cancer expert, while they have just like a naturopath locally who says, well, I don't really know much about pediatric cancer, but what tests should we do, or what supplements do you want to take?
What new kind of knowledge have you been uncovering and discovering through this process?
So much. I think through my own process, and what people don't realize is how much a cancer diagnosis, especially a pediatric cancer, how much it's not just about the child, but the parents, how a lot of these parents end up being my patients because of everything they've been through. So you really stop to neglect yourself, you stop sleeping, you don't take care of yourself, and then 3 years after your child is in remission and doing well, parents often fall apart. So it's this very interconnected, I always tell my families, if I'm telling you to eat this way or juice, or this isn't just something you're going to do for your child, this is a whole family thing. So I think that also how much fear there is in just helping pediatric families. Like, there's just not a lot of practitioners out there who are willing to do it, and I think my experience through going through it gives me that lack of fear, I guess you would say.
So, for physicians listening in who kind of have that nervousness, I guess I'm just wondering, I know you just said it's kind of having gone through it, it contributes to your lack of fear, but it's still you're putting yourself out there on an extremely controversial topic, and is that just something you basically have accepted and move on, or is that something like you have taken steps to address? Or
I think that we all have to take more of a stand for pediatric cancer patients. I don't think that it's fair that in a lot of these conferences we're patting each other on the back at how wonderful we're doing for adults, and I think that we need to just do a better job for kids. It doesn't have to be controversial therapies. It can just be nutritional support. It can just be all these very basic things that we talk about in adult cancer. I think just to have less fear and not think that just because you decide to support a pediatric cancer, it means that you're going to be doing things that, are going to get you in trouble. As much as just being open to, sometimes the questions are so basic. Like, what do we eat now? How do we detox? What's a detox bath? Why should I be jumping on a trampoline? I hear about that. Sometimes it can just be just stepping out and realizing so little is being done. The amount of funding that goes into pediatric cancer research is like less than 4% of all funds. So it's like 96% of all funding goes to adult cancer research. 4% or less goes to kids. So I just feel like in all aspects they're being neglected, and at least as these beautiful integrative practitioners that I've met here at this conference, we should all really recognize that more, and at least if the conventional side of it and the government isn't doing it, we should be doing it.
I'll be back with more from my interview with Dagmara in just a little bit. First, let's listen in as Executive Director Wendy Chappell shares a few thoughts.
Hi, this is Wendy, and I'd like to talk to you about becoming a member of ICIM. The very best benefit we can offer you are conference discounts. And you can save a significant amount of money when you plan to join us at our in-person gatherings if you are a member. Members can join at any time before the conference, during the conference, or even after the conference, and you will get a refund to match the member rate. We have 2 meetings coming up. One is in March in Philadelphia. The other is in October in Toronto. And if you come and join our community, connect with our members and the wider network we bring together, meet the people you need to meet, you will be receiving the very best benefit membership in ISOM can possibly give you. So if you're interested, email me, wendy@isomed.com. That's wendy@icimed.com. And we can talk over what becoming a member might mean to you and might look like in your life. Thank you.
Now, back to my interview with Dagmara.
So for the parent who, you shared a lot of your thoughts to your colleagues, for the parent whose child has been diagnosed with some form of cancer, and they've been doing conventional treatment or not, but they want something more, but they're just kind of nervous and fearful about what it means to step out there and maybe care about things that their oncologist isn't talking about. What would you say to the parent?
Yeah, so my first advice to all parents is pause and breathe. And you are always made felt that there's no time.
Yeah.
Chemo and treatment has to start tomorrow. And in 99% of the cases, there is nothing that's going to happen if you wait. If you give yourself a week or maybe 2 weeks to just start to do research, instead of, there's been too many situations of families who have come to me who even in our case, the wrong chemotherapy was given to the child because we weren't even given time to think and research. 2, a lot of families by conventional oncology are told no supplements, nutrition doesn't matter, and in those cases, it just using common sense. So we are taught how important in life what we put in our body food-wise is. Like nobody will disagree against that. So why all of a sudden when you have a cancer diagnosis is that thrown out the door? Like it's common sense.
Yeah.
You just want to support the body you want to overdose the body with nutrition.
Yeah.
So I think just having a conversation, I think there's a lot of fear instilled into parents who have kids diagnosed, a lot of hope taken away, and a lot of responsibility taken away.
Yeah.
And my job, I think, primarily is to give hope back, but to also put responsibility back and say, it does matter what you now feed your kid.
Yeah.
It does matter what decisions you make. And that's hard to hear because it's a lot easier, I think, to go into it, okay, the doctor's going to take care of everything. They're going to make all the decisions on the chemo. We don't have to do anything. We didn't do anything wrong. No, you do. You have to now help your child through this process.
Yeah. It's also empowering in the other sense because you're not watching helpless with nothing to do as your child's going through treatment.
Very empowering to know. It made me, and I know so many of my families, feel so much better to know that, hey, I'm putting these herbs into my kid's bath and that potentially could be helping draw out the chemo. It gives you a sense of that control that as human beings in those situations, sometimes we need just to get through.
Yeah.
Yeah. And it's good stuff, right? You're controlling good stuff like super juice and good supplements. And
do you have any particularly, maybe a particularly challenging case that you could share a story about?
I think the most challenging case, and it doesn't have to be a particular story, is when you have, for example, I have a child who has a brain tumor, and he's been living with it for 2 years, and he's been through every single chemotherapy that they could have thought of, and nothing's really, quote unquote, worked. He's never been considered in remission, and things have just slowly progressed. And in my mind, that is a wonderful situation where, hey, let's try ketogenic diet, let's try high dose vitamin C, things that are, we now know, smart things to try, right, when there is a brain tumor. And not presenting that to the family and the family getting excited and open, and then when they go to the conventional side and they bring these ideas up, they would still rather do these really toxic experimental trials and not consider it. And so families are left in this gray area of just confusion and fear. And I think that's the hardest case, is you want to help and you want to support. You want to explain to them, every single child who has had chemotherapy has a leaky gut, right? So they're not absorbing well. Like, you have to concentrate on healing their gut in order for them to actually absorb some of the supplements that you want to give them. And like, there's no mention of that in conventional medicine.
Yeah.
So I think it's just these worlds that need to work together.
Yeah.
That's the most frustrating.
What's next for you?
What's next for me? Well, we are in the middle of building out a bigger practice because we have a need, which is wonderful. So we're making a bigger IV therapy room and expanding our staff. So, locally, just being able to help more people. There's been more and more people coming from out of state, which is beautiful. On a more personal level, we are building a retreat center on our land. We own farmland, and so we're building a retreat center so that I can actually take some of these families who travel from far, and instead of them stay in a hotel room while people get therapy, give them an organic dinner and bone broth and teach them how to make super juice.
Yeah.
So that's hopefully in the next couple years going to be accomplished.
Yeah.
And then nationally, just stepping out more for pediatric cancer, and I want people to know that I'm out there, and that I want to be part of their team. Even if it's just nutrition, right? Sometimes people are only willing to change how they eat, and that is huge, and that is wonderful.
Yeah.
So just, I think that's it.
That's awesome.
Yeah.
Thinking back to how you've changed as a clinician over the years, how do you feel like you've transformed as a practitioner?
Oh my gosh. So I practiced as conventional medicine as you can get. Emergency medicine is very much cookbook medicine. And while in acute care, I think that's one areas that we excel in, life-saving, but a lot of emergency medicine becomes family practice and urgent care. And it just became customer service and people wanting their Zithromax for their runny nose for one day. And I've done a 180 to, I have never been so excited in my life to learn more. I have never not had enough time to learn, like all these books I want to read and network, and actually sit down and think through every case with like 5 open books on my desk. I feel like I'm finally, for the first time, truly using my brain and my heart together. And before, it was just this very automatic, like what I learned in school recipe book.
What do you want medical students, whatever their form of training, what would you love for them to know as they're getting ready to enter into the real world?
To think outside the box. They are not taught to think outside the box. And many times, for many patients, that's where the answers are, is outside the box.
Finally, this is your first ICIM conference, right?
Yes.
Can you tell me what you thought about this?
So this has been my favorite conference I've ever been to. Never had I met a more down-to-earth, funny group of practitioners. With the most amazing food. So, what do you feel like this does for you as a practitioner? It makes me excited. It makes me realize that I have so much more to learn, yet at the same time, it also makes me realize how much I already know, and that people who have been doing this for 20 years more than me sometimes feel like they have just as much to learn. So it's just, and I'm not afraid. Like here, it just feels like you can sit down at lunch with anybody and ask them anything, and everybody's willing to share. And I love that, because oftentimes it's during breakfast and lunch, when you network and walk around, it's where you really are like learning more sometimes, and even at some of the lectures, it's lovely.
Yeah. And do you have you had the chance to ask any of the practitioners in the group who've been doing this for 20, 30, 40 years?
Yeah.
Have you had the opportunity to, been able to ask about whether it's about a specific case or a certain type of therapy that you're wanting to integrate? Have you been able to tap into that while you're here?
100%. I mean, I've literally been like chasing doctors and practitioners down, like, hey, have you done this on a kid? Did you combine it with this? What should I do with this? And everybody's just stops and willing to share and exchange cards. And I really believe them, like when they say email me and I'll answer you, like that's actually going to happen.
Yeah. Oh, that's so wonderful.
Yeah.
Well, thank you so much for sitting down and taking time to chat with me.
Thank you.
Awesome. Thank you.
Awesome.